Over the past week, there were an average of over 4,350 new cases being reported daily across Canada. However, severe illness trends are still increasing, with an average of more than 2,400 people with COVID-19 being treated in our hospitals each day, including almost 800 in intensive care units, and 38 deaths were reported daily. COVID-19 cases and hospitalizations are predominantly occurring among unvaccinated people. From mid-August to early September, the average weekly rate of new COVID-19 cases was 10 times higher, while the average weekly rate of hospitalizations was 38 times higher in unvaccinated people than in fully vaccinated people. Although very high vaccination coverage is needed to offset the highly contagious Delta variant, COVID-19 vaccines are making substantial contribution to population protection. Where vaccination coverage is lower and rapid epidemic growth is occurring, public health measures are crucial to rapidly reduce contact rates that fuel virus spread. Administering vaccines and building up immunity across the population takes time, but reducing the pool of susceptible people through vaccination is also vitally important for preventing severe and/or potential long-term complications of COVID-19 infection that puts pressure across the health system. Increasing vaccination coverage quickly can also help reduce the duration and overall impact of the Delta wave on healthcare, schools, businesses, and other essential services. Experience the world over has shown that what works best is a combined approach of achieving high vaccine coverage, making indoor spaces safer through improved ventilation, and individual layers of protection, such as masking and spacing, and reapplying public health measures to slow the spread and minimize serious illness where the virus is surging. This week, Canada's National Advisory Committee on Immunization released updated guidance recommending an mRNA COVID-19 vaccine booster dose be given to residents in long-term care and seniors in other congregate settings who are at higher risk of exposure and serious illness. NACI is also advising that COVID-19 vaccines may be given at the same time as or any time before or after other vaccines. This is great news and means that COVID-19 vaccines can be co-administered with other vaccines. This will make it easier for people to get their influenza vaccine this fall, as well as catch up with other routine vaccines that may have been delayed during the pandemic. Thanks to the added protection of COVID-19 vaccines, this is the first time since the pandemic began that we will gather in larger numbers indoors this fall and winter. While our protection against COVID-19 has been bolstered by vaccines, we also need to think about the return of other respiratory infections. In addition to getting up to date with recommended vaccines such as influenza and other routine vaccines for children and adults, we can stay healthier by keeping up with hand and cough hygiene practices, getting the best ventilation possible in our indoor spaces, and staying home and away from others if we develop symptoms. Finally, I'd like to end by acknowledging that yesterday was the first National Day for Truth and Reconciliation. Going forward, we can continue to honor those who were lost and show compassion for survivors by listening, learning, and striving to understand the ongoing impacts of residential schools on First Nations, Inuit, and Métis people and communities. There are many learning resources on the National Day for Truth and Reconciliation website, which I will link to from our remarks posted online. Thank you. Merci, Megwidge.
Bonjour à toutes et à tous. Aujourd'hui est la journée nationale des aînés.
Hello, everyone. Today is National Seniors Day, reminding us of the important contribution of elders in our lives and how we can give back every day with our time, companionship, and support. The latest surveillance data show ongoing regional variation in disease activity. But overall, epidemic growth appears to be fairly stable nationally. Over the past week, there were an average of over 4,350 new cases being reported daily across Canada. However, severe illness trends are still increasing, with an average of more than 2,400 people with COVID-19 being treated in our hospitals each day, including almost 800 in intensive care units, and 38 deaths were reported daily. COVID-19 cases and hospitalizations are predominantly occurring among unvaccinated people. From mid-August to early September, the average weekly rate of new COVID-19 cases was 10 times higher, while the average weekly rate of hospitalizations was 38 times higher in unvaccinated people than in fully vaccinated people. Although very high vaccination coverage is needed to offset the highly contagious Delta variant, COVID-19 vaccines are making a substantial contribution to population protection. In regions where vaccine coverage is lower and rapid epidemic growth is occurring, public health measures are crucial to rapidly reduce contact rates that fuel virus spread. Administering vaccines and building up immunity across the population takes time. But reducing the pool of susceptible people through vaccination is also vitally important for preventing severe and/or potentially long-term complications of COVID-19 infection that put pressure across the health system. Increasing vaccination coverage quickly can also help reduce the duration and overall impact of the Delta wave on healthcare, schools, businesses, and other essential services. Experience the world over has shown that what works best is a combined approach of achieving high vaccination coverage, making indoor spaces safer with improved ventilation, and individual layers of protection, such as masking and spacing, and reapplying public health measures to slow the spread and minimize severe illness where the virus is surging. This week, Canada's National Advisory Committee on Immunization, or NACI, released updated guidance recommending an mRNA COVID-19 vaccine booster dose. That this booster dose be given to residents in long-term care and seniors in other congregate settings. People who may have a higher risk of being exposed to the virus and severe illness. In addition, NACI is also advising that COVID-19 vaccines may be given at the same time as or at any time before or after other vaccines. This is great news and means that COVID-19 vaccines can be co-administered with other vaccines. This will make it easier for people to get their influenza vaccine this fall, as well as catch up with other routine vaccines that may have been delayed during the pandemic. Thanks to the added protection of COVID-19 vaccines, this is the first time since the pandemic began that we will gather in larger numbers indoors this fall and winter. While our protection against COVID-19 has been bolstered by vaccines, we also need to think about the return of other respiratory infections. In addition to getting up to date with recommended vaccines, such as influenza and other routine vaccines for children and adults, we can stay healthier by keeping up with hand and cough hygiene practices, getting the best ventilation possible in our indoor spaces, and staying home and away from others if we develop symptoms. Finally, I'd like to end by acknowledging that yesterday was the first National Day for Truth and Reconciliation. Going forward, we can continue to honor those who were lost and show compassion for survivors by listening, learning, and striving to understand the ongoing impacts of residential schools on First Nations, Inuit, and Métis people and communities. There are many learning resources on the National Day for Truth and Reconciliation website, which I will link to from my remarks posted online. Thank you. Merci, Miigwech.
Merci, Dr. New and Dr. Tam. Thank you. We will now open the phone line to questions. We ask that you limit yourself to one question and only one follow-up. As usual, we'll be taking questions in both official languages. Donc, nous allons prendre vos questions au téléphone. Nous vous demandons de vous limiter à une question et seulement une question de suivi. Vous pouvez poser vos questions dans l'une des deux langues officielles. Operator, first question. Opérateur, première question, s'il vous plaît.
Thank you. Merci. Please press star 1 at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. The first question is from, la première question est de Ryan Tumulty, National Post. Please go ahead, à vous la parole.
Yeah, hi there. I guess this question is probably best for Dr. Tam, but I'm wondering on vaccine hesitancy. The government is taking, I guess, some sort of stick approaches by imposing mandates and things like that. I'm wondering, what PHAC is doing on the carrot side, and maybe from previous campaigns, what you have known works and doesn't work when it comes to getting people to get vaccinated.
Yes, thank you for that question. And I'd point out that I was really happy to see that there's been a jump in first dose uptake in Alberta and in Saskatchewan, for example. So some of the latest action collectively by different levels of government, I think, is making some difference in the uptake, which is great, and we just need to keep going. From the Public Health Agency perspective, we have been using many different approaches to combat vaccine hesitancy or boosting vaccine confidence, including providing different media formats, social media, videos on our website from experts in terms of answering questions that people have. So providing answers to the leading questions that the general public have is very important, but also providing support, including grants and contributions to communities, to community leaders, community organizations who are trusted by their communities in order to increase vaccine confidence is also really important. There's no one size fits all, and many different approaches are needed. The other thing is access. So working with Indigenous Services Canada, Indigenous organizations, many people on the ground, the provinces and territories, and local public health to increase the access, whether it be mobile clinics or other means, is extremely important still. Working with the business sector in terms of providing them with tools, information that they can use for their employees is also really important, because they're going to have to answer questions from the employees as they put together the workplace requirements for vaccination, etc. So I think there are many different approaches. In terms of what things have worked, I remember there was a question a couple of weeks ago, maybe, on whether vaccine requirements work. And at that time, really, there's only empiric evidence and evidence from the application in other areas, such as school requirements for childhood vaccinations. But I do think that whether, I would say, together with other measures, these vaccine requirements in provinces seem to have nudged people to take up the vaccine. As I said, in Alberta, the first dose coverage went up by 4% just in the last while, which is tremendous. Just keep up the good work.
It's Dr. New here. Maybe I can add underline a couple of points of what Dr. Tam said. So certainly when you're looking at the carrot approach, as Dr. Tam mentioned, we have something in the federal government called the immunization partnership fund, and really it's a way to support local communities, specialized communities in terms of the leadership that can reach with sort of unique ways their target audiences in a way that let's say medical officials like Dr. Tam and myself can't at a national level. So that's very important. And we have certainly seen quite a range of very innovative approaches from these community leaders. The other thing I think we're doing that's, I think, been successful is looking at using what we call a segmented social marketing approach. And one of the target audiences I think we mentioned previously is sort of the young adult male population. So we've also worked closely with, quote, the gaming community, looking at the sort of leaders, role models in that community to also get the message across about how important it is to get vaccinated. And hopefully that's also having an impact. And finally, I would say that, in a positive way, I think things such as vaccine passports that I think, various governments in the provinces and territories have put in, I think have been effective because at the end of the day, I think it's about giving privileges to those who've made, I think, the right decision to get vaccinated so that they can undertake certain activities, go to a restaurant, to go to a sporting event and so on. Because I certainly, when I have gone into those establishments, I feel much more comfortable and safe knowing that everyone around me as well has taken the decision to get vaccinated. And we're all sort of not only protecting ourselves, but protecting each other. So I think with all of those range of tools, those are some of the ones that we're seeing are having a positive impact right now. Thank you.
Thank you, doctors. Follow up?
Yeah, I'm just wondering if you have modeling or have looked at research as expect to be the necessary level of vaccination to finally put an end to the pandemic. I know it's probably going to involve vaccinating people from 5 to 11, but I'm just wondering sort of what the target has to be.
Yes, it's Teresa Tam. So the Delta variant, of course, being more transmissible, has led to an increase in vaccine coverage level requirement to help move towards community immunity or herd immunity. So that's been the latest challenge, which means that you have to have very high vaccine coverage. But the vaccine coverage level required is also dependent on your local epidemiology. For example, how many people have had past infections, as well as the vaccine uptake, and also the contact dynamics of the population, whether you're densely populated or sparsely populated population, or whether you've got a congregate living or not so crowded living conditions. So the reproduction number, which you've heard in our modeling sessions, is how many people would a singular infected person with, say, the Delta variant infect, can vary in different contexts. So that's all to say is that this is not a static estimate, but can be different for different communities and populations across the world, but certainly even within Canada. We know that with a reproduction number of around 5 or 6, for instance, that you will need around, over 80% vaccine coverage to move towards herd immunity or community immunity. So that is a particular target. That's the denominator, which is the total population, not the eligible population. So that is one parameter we can look at, but there needs to be an understanding more locally as to what that target might be. But all to say is, as I've said, go big, go as much as possible, reach for the stars, get to 100% if you could, even though that seems like a stretch goal. That's what you need to do with a very transmissible variant.
Thank you, Dr. Tam. Opérateur, prochaine question.
Thank you. Merci. The next question is from La prochaine question est de Louis Blouin, Radio-Canada. Please go ahead. À vous la parole.
The question is for Dr. Tam, but Dr. Sharma, feel free to answer too. Government officials are putting together a mandatory vaccination model for public servants. Do you think it would be preferable to ask for proof of vaccination, that this mandatory requirement be paired with a request to give a proof of vaccination? Would you recommend it?
So if I understood the question correctly, it's about the vaccine requirement for the federal public service. Is that correct?
Yes. Yes.
Yes. So the Treasury Board and others are working hard at this, and there's a rapid implementation phase that we expect to happen. As the public health agency, we provide guidance, but the execution and operationalization is up to the employer. That they are now figuring out the instructions to staff in terms of providing, for example, attestation of their vaccination status. So all of that is still in the works, but I expect that there'll be implementation announcements pretty soon on exactly what employees need to do.
But don't you think that it would be more efficient if there was a proof of vaccination requested? I'm asking about maybe your expert advice on that.
Yes, there will be, I think, involved in this process a request for submission by staff of their vaccination status. If what you're talking about is should people show proof upon entry to different buildings, that is an operational requirement that I think needs to be sorted out by the departments. But I think the concept is that you need to make it operationally feasible. So I'm not the executor of that plan, but I'm sure there'll be different modalities also being explored for different work contexts, whether you're public facing or not, for example, in terms of your work, or whether you're working in a office setting with no interaction with the public. So it's a complicated program to roll out. And there will also have to be arrangement for testing, for example, for those who can't get a vaccine.
Thank you, Dr. Tam. Operator, next question. Prochaine question.
Thank you. Merci. The next question is from La prochaine question est de Kevin Gallagher, CTV National News. Please go ahead. À vous la parole.
Hello, my question is for Dr. Sharma, actually. So the United States and looks like Health Canada is looking at this treatment developed by Merck for COVID that seems to reduce hospitalizations. I'm wondering, there's a rolling approval now for Health Canada, but is there any expectation as to when that approval could be finished, or what this type of treatment could mean for the current situation facing many provinces dealing with a fourth wave?
Sure, thank you. So I think you're referring to the molnupiravir, which is a medication that's given within 5 days of the onset of symptoms. And there's been some clinical trials that have shown that it's been very successful in preventing disease. So Health Canada received that submission for molnupiravir on August 13th. And we're actually working with some of our international counterparts going through the review of that. The US FDA has yet to receive a formal submission, and they expected to get it shortly, as well as the European Medicines Agency. So we are looking at it. Certainly we're going through, as we said, that the data, it does take some months to go through that. So we don't have a specific time for completion of that, but it'll be held to the standards of all of our reviews. And just to note that that's actually going through our regular review process. So it's not the interim order process. It is the review that we would do for all medications or treatments. But we've also incorporated the rolling submission process there so that companies can give us individual and additional information as it becomes available. So we are working on it. Again, we're working on it collaboratively with our international partners, and we'll authorize it if it meets the standards.
Thank you. Follow up?
Oh, nice.
Yes, I'd like to follow up on the Janssen Johnson & Johnson vaccine. There are some provinces that are requesting more supply, and I'm just wondering, perhaps there's a question here for Dr. Sharma, but also maybe a question for Dr. Tam. There seems to be a need to try and use the Johnson & Johnson one-shot vaccine for people who are still unvaccinated or those who have hesitancy towards the mRNA vaccines. Number one, there was an initial problem with some of the approval for the production facilities of some of these Johnson & Johnson vaccines. Canada currently doesn't have any stockpiled, but we're going to look for some. How soon could Canada get a hold of the required Johnson & Johnson? And is this strategy, it seems, by the provinces something that public health, approves of? Is it a good idea to try and combat vaccine hesitancy by using a different vaccine?
Sure. Maybe I could start on the regulatory side of things, and then I'll turn it over to Teresa and Howard. So the Johnson & Johnson or the Janssen vaccine is authorized for use in Canada. So it can be used. Again, it's right at this point in time, it is authorized as a one-dose vaccine. There have been some studies that have come out to show that there is added benefit from a second dose of the J&J vaccine to help boost immunity. And in some countries, they've already started to boost with a second dose, either of the J&J vaccine or in some countries like France with the mRNA vaccines. The supply situation is that it has regulatory approval. There are a number of different sites that do the manufacturing or the distribution or the packaging that are authorized. There are some sites that still have some issues around quality and quality manufacturing. So we would only allow the importation of the Janssen vaccine that actually would meet all of those criteria. So we wanted to make sure that the level of safety and the effectiveness of the vaccine meets what was authorized. So we really would make sure that whatever was procured, the appropriate regulatory reviews of all of those sites that were involved in the manufacture and the distribution of the vaccine were up to par and up to standards, and then it would be allowed in the country. But in terms of the sort of supply and the use, maybe I'll turn that back over to Teresa.
Thank you, Dr. Sharma. So there has been some very recent discussions at the Special Advisory Committee with the other Chief Medical Officer. Given some provinces have an interest in accessing some J&J or Janssen vaccine doses in this last mile of trying to get their populations vaccinated, I just want to reiterate that the mRNA vaccines are safe and effective. The viral vector vaccines also includes the AstraZeneca vaccine and the Janssen vaccine. As Dr. Sharma said, that the Johnson & Johnson vaccine may benefit from a second dose. So I think for individuals who are thinking about this as a one-dose vaccine, more information is likely to be forthcoming in the near future on that. The National Advisory Committee is also examining the need for additional vaccines, including for individuals who've actually had a viral vector vaccine such as Janssen. So we expect more to come from that committee as well on this front. Having said that, a number of chief medical officers have indicated that, well, it's better than not vaccinating certain individuals if that is the only vaccine that is accepted by certain populations. So with that principle in mind, we are trying to get some doses as fast as possible. I think one thing that we need from the provinces is a good estimation of the amount that is required. We do not want to waste any vaccines that can help other countries in the world. And so that is an ongoing exercise right now in terms of the outreach. And we're waiting for provinces to get back to us on that front.
Thank you, doctors. We'll now move to the next question. Operator.
Thank you. Merci. The next question is from La prochaine question est de Catherine Lévesque, La Presse canadienne. Please go ahead. À vous la parole.
Oui, bonjour à vous tous. Tout d'abord, je voulais peut-être
Question. First of all, I'd like to hear in French from Dr. New about what Dr. Tam was just talking about regarding the possibility of doses of the Janssen and Janssen vaccine. I'm wondering where those doses would come from. And if perhaps you could mention whether there would be a deadline for the provinces so that they could get back to you about the number of doses they're asking for. Answer. Thank you for the question. And perhaps I can also summarize what Dr. Sharma said. We are currently communicating with our provincial and territorial counterparts regarding their requests for the Janssen vaccine. As Dr. Sharma said, from a regulatory perspective, we always want to ensure that any vaccine entering Canada meets Health Canada's standards regarding safety and effectiveness. So I think that there have been challenges with a facility in the US, but there are various different sources. There are other facilities that could be a potential source. That's something to think about. But with the provinces and territories, as Dr. Tam mentioned, this is really an area where the provinces and territories need to tell us. Because in each province and territories, there may be a segment of the population who may be more comfortable getting the Janssen vaccine for a wide variety of reasons. But we want to ensure that people know that the Pfizer, BioNTech, and Moderna vaccines are still safe and effective. We want people to know that. So that's not part of the issue. But if there's enough demand, and we're still discussing this with our counterparts, well, then we'll need to discuss exactly how many doses will be requested by each province and territory. Because if we make an order on behalf of the entire country, we want to make sure that we can use all the doses here in Canada and not waste them, because there is demand everywhere in the world. We want to make sure that the vaccine will be used in Canada. And so I think that if we really want to vaccinate as many Canadians as possible, and we already have a selection of vaccines approved here in Canada, well, if there is a request from the provinces and territories, we will react to meet their request. Follow-up question? Yes, I'd also like to hear from you, Dr. New, in French on a different topic. When can we expect Pfizer to give us more information on the vaccination for children between 5 and 11, and how long will it take for Health Canada to give its approval? Answer. Thank you. Well, I think Dr. Sharma may want to answer that, but we have discussed that between colleagues. So far, we have not received a submission from Pfizer or Moderna regarding vaccination for children between 5 and 11, as you stated. But we are waiting because we know that the companies are continuing to carry out clinical trials, and they are ensuring that there will be solid data. But we are looking forward to getting that from them. And after receiving a submission from any of these companies, we know that our colleagues at Health Canada will be working very hard and as quickly as possible to approve the vaccine. But it's very important that we not cut corners. We need to review the data very carefully. We need to absolutely ensure that that is done before producing an approval. So I can't give an exact date. But I do know that there are a lot of people who are ready to work around the clock once they've received the submission from any of the companies. I don't know if Dr. Sharma would like to follow up on that at all, perhaps in English or in French.
Oui. Oui, donc les questions portent à la submission pour les jeunes 5 à 11 ans.
Yes, regarding the question about vaccination between 5 and 11.
Just around when we're expecting the submission from specifically Pfizer for children for the COVID-19 vaccine for those 5 to 11. And what we've heard from Pfizer is there's two parts of it. One is the clinical trial data. So the clinical trials have been completed for that age group, and they've submitted that, or they've given that clinical trial data to the United States FDA, but they haven't given them a formal submission yet. We're expecting that clinical trial data to come to Canada as well early next week. And then they'll file a submission with the US FDA. And then shortly thereafter, they'll file a submission with us at Health Canada. And we're expecting that to come in likely before the middle of October. But they have noted that they'll give us some clinical trial data in advance. We can start working on that. This is a rolling submission, although it is not coming through our interim order process, so that equivalent to the emergency use authorization is coming through our usual vaccine authorization. So the way that we would look at all vaccines in Canada, we have a dedicated team that's ready to receive that information and review it as soon as it is available. And we would only authorize it if it was shown that the benefits outweighed the risks, specifically for this group of individuals from 5 to 11. And the other thing that I just wanted to mention is that we'll be dealing with a different formulation. So it's a different dose in this younger age group. It's a lower dose compared to that of the adults. And there are some differences in the formulation as well. So it's not just the clinical trials and how effective and safe the vaccine is, but we'll also be looking at this other formulation. And it really depends on the data, how long that review will take. And as soon as we have a chance to receive that and take a look at that, we'll be better placed to give people an idea of how long that might take.
Merci beaucoup, Dr. Sharma. Opérateur, prochaine question. Next question.
Thank you. Merci. The next question is from, la prochaine question est de Elizabeth Thompson, CBC News. Please go ahead. À vous la parole.
Yes, thank you very much for taking my question. You've mentioned vaccine passports, and we're seeing increasingly that everyone from businesses and provinces to employers are requiring proof of vaccination. But we recently did an investigation. We discovered that there are a lot of fake vaccination certificates that are being offered for sale online. So I was wondering if I could get your reaction to the fact that there are people out there selling replicas of certificates to people who don't want to get vaccinated, and what the government plans to do about it.
Yes, I can't speak to the role of the province and the territories, but certainly this is a issue that we're well aware of for the international border, for example. So we're always trying to be vigilant towards any fraudulent certificates. And when we do spot them, we emphasize that there are big penalties to submitting false information to the Government of Canada as it pertains to our border requirements, so that enforcement can be done after that. It is a serious breach of government rules if you break them, and that pertains to the international border. Of course, provinces will have their own mitigation measures, but it is an issue that we're all aware of. Now, on top of that, of course, we're working with the provinces and territories to look at the standards, to look at how vaccine proof, electronic vaccine proof included, can be standardized and be presented in formats and ways that are verified by or credentialed by the provinces, and in the future, credentialing by the federal government for international travel, which we have to work with other countries. So it is a matter of both provincial, federal, but also the international level as well. but there are consequences from a federal perspective.
Thank you. Follow-up question?
Yes, follow-up is, when you look at those sites, they're not only offering Canadian credentials, they're also offering cards from the CDC, from the NHS, from places around the world. Is there any move afoot to try to have an international database or an international proof of vaccination? Because these guys are also suggesting that they are able to input the fake data into official government databases.
Yes, I'm not the expert in this area, but I know that we've been working very hard in the international level with other partners and the WHO, other countries, including the G7, G20, and others, on the proof of vaccination for international travel. So all of that is actually in the works, and part of that will be on this credentialing approach in order to for mutual recognition, but also build into that certain features which to minimize fraudulent copies or fraudulent attempts at replication. But I'm sure is a big issue that must be part of the path going forwards. But I think it may be a question that we will take back to other government departments as well, because I think there are ways that other departments can deal with sites which are essentially providing these false certificates. And I think every country needs to examine the tools of which it can de-escalate or shut down such sites and practices.
Thank you.
Thank you. Thank you, Doctor. Operator, next question.
Thank you. Merci. The next question is from La prochaine question est de Zach Vachera, Saskatoon Star Phoenix. Please go ahead. À vous la parole.
Thank you very much for taking my question. I have a question I suppose for Dr. Tam, and I suppose others could weigh in. Dr. Sakib Jahab, the Chief Medical Health Officer in Saskatchewan, said recently that the province is bound for a fall winter of misery, is the way he put it, postulating or projecting that our very high case numbers are not likely to go down until perhaps Christmas or even beyond that point. I wonder what federal modeling says about that. Is it indeed true that provinces with very high case counts like Saskatchewan, Alberta, can expect potentially another winter of lockdowns or very, very high case counts?
Yes, I'll start on the answer to that question. I think the bottom line is depends on what we do. Depends on what happens in that particular province. You can bend the curve, and we know how, but these measures have to be taken. So, for example, the number one thing we've been stressing is rapid escalation of vaccine coverage. That will modify your trajectory in terms of the Delta wave and how many people get into ICUs and hospitals, because these vaccines are very effective at preventing serious outcomes. But vaccines take 6 weeks to go from first to second dose and wait 14 days at the minimum. So they are not the fastest tools to use to suppress a current wave, but they will help to dampen the wave going forwards, or the whatever epidemiology and up and downs in the different jurisdictions. Vaccines are going to help. And we said that in our last federal modeling session, that getting that gap in vaccine coverage for the young adults will help in shaping the epidemic curve to come. So things can be done. But if you need to curb the current resurgence, you have to reapply some public health measures, because that's the fastest way to suppress the transmission by reducing contacts while the vaccine coverage is being elevated. Otherwise, there is a risk for overrun of the healthcare system. So you need both at the moment, but we know that the curve can be bent. At the national level, as I said at the beginning, we are seeing that curve bending as we speak and plateauing across many parts of the country. and a slowing down in Alberta in terms of cases, not yet in the ICUs and hospitalizations, but it can be done. It's not an inevitable trajectory. So I think the most useful parts of showing models, for example, is so that you can actually do something about it and change your course.
Yeah, it's Dr. New here. Maybe I just add to that, just to what Dr. Tam has said with respect to modeling in Saskatchewan. We continue to be in close contact with our counterparts, and I can say personally, I've had several conversations, discussions with Dr. Shahab regarding the Saskatchewan situation. And I think we're both agreed on one point, as we're all with the other medical officers of health across the country, and that is vaccination coverage is so important. And if you look at the statistics, I think Saskatchewan compared to the other provinces and territories still has some ground to make up. Dr. Shahab recognizes the challenges in certain communities in terms of the uptake of vaccine, both for first and second doses. They're making progress. I think the rates are increasing, but that really is at the heart of it. And so from a federal perspective, any tools, any way we could help support Saskatchewan with increasing that vaccine coverage, I think, would be helpful to them. But as Dr. Tam says as well, obviously they take some time to be effective. And in the here and now, obviously with the strain on their healthcare capacity, we're also looking at other ways of supporting at the current time. But I think Dr. Shahab and public health colleagues across the country, as well as the healthcare system, we recognize it's a critical time right now. And if there's ways to reach maybe some of the community leaders in some of those communities that have maybe lower vaccination rates, we're certainly, open to further discussions, looking at all sorts of tools and other supports that we can do, can put forward to obviously increase the overall objective of increasing vaccine coverage. Thank you.
Thank you. Follow-up question?
Yes. Again, for Dr. Tam and perhaps Dr. Sharma as well, and others can weigh in. Premier Scott Moe in Saskatchewan has said that he would very much like to see an expansion of the use of monoclonal antibodies in Saskatchewan. He actually said that he'd like to see it used in Canada and in Saskatchewan in the way that that therapy is used in the United States. I know Health Canada has approved, I think, 3 courses of treatment that are related to those antibodies, but I was wondering, Dr. Tam, if you could help clarify what the clinical evidence is around those treatments, how useful are they, and how much will they help in a situation like what we see in Saskatchewan today?
Yes, maybe I'll start, and if Dr. Sharma has anything to add, she will do so after this. So there are several different types of monoclonal antibodies that have been authorized for use, as you said. It is up to clinicians and clinical practice to apply the use. And one of the difficulties, I think, with monoclonal antibodies is that some of them have to be given quite early on in the clinical course and intravenously, which is quite difficult to apply in the clinical context. But it can be worked out on the ground in terms of how clinicians can use them. And we've been monitoring, of course, together with the regulator, the effectiveness of monoclonal antibodies against the virus that is changing. And so, they do have varied effectiveness, but they're an added tool when you have patients, particularly in the high-risk categories. And so I think continuing to work and facilitate, I think, the sharing of best practices, including clinical practice between provinces, is something that we can certainly support. But ultimately, it is a matter of the people providing the treatments who come down with the guidance that is required for the use. So that might be part of it. And the interest in the Merck antiviral is because of ease of use, and you can give it up to 5 days in the start of someone's clinical course. So you have a bit of time, and then can be applied orally to someone, for example, with some moderate symptoms, mild to moderate. It can be more feasibly done. So there are lots of different factors at play, I think, as to why the uptake of monoclonals might not be as high in certain areas of the country or of the world. But we're certainly here to support provinces in terms of trying to access supply as long as they can provide us with an estimate of how much that requirement would be by consulting with their own clinicians.
Thank you very much.
Maybe
go ahead.
Thanks, Eric. So I'll just add a couple of things. I think with the monoclonal antibodies, it is a treatment. It's used primarily in two groups of patients. One is people who have either mild to moderate disease and to prevent them from getting very sick, or you have people that are in hospital that are quite ill and they haven't mounted their own antibody response. So you're actually giving them the antibodies that their body would either provide or make naturally, or potentially they would get from vaccines. One of the challenges with monoclonal antibodies is that they are also a bit vulnerable to new variants that come up. So they may not necessarily be all that effective against, some are not that effective against the Delta variant, for example. So from the Health Canada perspective, when we look at the regulatory reviews, we look at the data, we look at the clinical trials, and then in that authorization, we summarize how they can be used. So what are the most appropriate ways that they would be used? What are the indications? What populations? If there are potential adverse events to look out for, all of that as well. And then it really is up to the clinical groups to decide for an individual patient whether or not that's something that is useful. So there are a number that are already authorized. We have other ones that are also under review as well, but it's really providing those in the armamentarium for clinicians to be able to use. And again, of course, the government of Canada has procured some of these monoclonal antibodies, which can be quite expensive. So they are also being provided to the provinces without additional charges. So it really depends on the clinical cases, and physicians will know their patients and their conditions and what variants they might be having more intimately than we would at the federal level, but really are doing everything that we can to make sure that at least they're authorized and they can be made available in Canada.
Yeah. It's Dr. New. Maybe I would just add a final point, as Dr. Sharma said. If you're looking at the procurement angle, certainly we always have ongoing discussions with our provincial and territorial officials with respect to the need and demand for these monoclonal antibodies, based obviously on sort of clinicians' demand for them. And we also, on behalf of Canada, we actually are having very active discussions with the companies so that we can in real time and make sure that we can sort of fit the demand with the need and then make the appropriate orders on behalf of Canada, and then obviously get them out to the provinces and territories as they're needed. Thank you.
Thank you, doctors. We have time for one last question. Dernière question, opérateur.
Thank you. Merci. The last question is from La dernière question est de Laura Oshman, the Canadian Press. Please go ahead. À vous la parole.
Thank you. My first question is for Dr. Sharma, to pick up on what you were saying about the process for the children's Pfizer vaccine. I was hoping you could just sort of explain the difference between the rolling approvals and the interim order, because many people have the impression that if it's approved under the interim order, it's a less thorough investigation of the safety of the vaccine. Can you just talk a little bit about the difference and what it means for the safety and efficacy of the dose?
Right. So the pediatric submission will actually not be coming in through the interim order. The interim order is really something we put in place to give us regulatory flexibilities. If we really look at the safety and the efficacy data that we look at and the quality data that we look at, really there's no difference between what we looked at and we needed for authorization under the interim order and what we look for through the regular process, which is called a new drug submission. So just wanted to reassure people that whether or not it was coming through the interim order process or the regular review, we were holding those vaccines to the same high standards as we always would. And really what it did is that it gave us some regulatory flexibilities. So we had talked before about the rolling submissions so that companies could provide information as it becomes available rather than waiting till everything is complete. wait to give it to Health Canada. There were provisions in the interim order for something called pre-positioning, so you could bring product into Canada before an authorization, for example. So what we've done is that for all the COVID-19, whether it's vaccines or medications, we've taken the parts of that interim order process that we found useful, such as the rolling submission, and we brought them into our regular review. So we're looking at the same data, we're holding them to the same standards, we have the same dedicated teams that are looking at them, and again, really making sure that they overall meet the evidence bars for safety, for efficacy, so that they do what they're supposed to do, and for quality, to make sure that those vaccines, the millionth vaccine that comes off that line is exactly the same as the first, and to make sure that all the information on how to use the vaccines are available as well. So really, no difference.
Thanks, Dr. Sharma. I also wanted to ask about the flu in Canada. The first flu report came out today, and it showed higher than expected incidence of some respiratory viruses. This could be the first year where we have a major flu season and COVID-19. Aside from the usual sort of personal hygiene things, how does public health handle that, and how are emergency rooms and hospitals expected to handle that as well? What are you expecting?
Yes, so as you said, this could be the first season or the return of the other respiratory infections since the start of the pandemic, because we hardly had any of the other viruses last year. And we're beginning to see some of the usual respiratory viruses returning, including respiratory syncytial virus or RSV, which can be quite severe in younger children. So pediatricians, pediatric hospitals and others have been preparing for potential incursions of more than one virus. So that's something that they are preparing for sure. But I think by maintaining some of these routine hygienic measures, including not sending sick children to schools or daycares, for example, could certainly help, and all the measures that we've learned over the course of this pandemic can help. The other thing that I mentioned in my opening remarks is keeping up with routine vaccines. Some of the viruses but can also be prevented through immunizations, such as measles, for example. We really need to keep up and make sure we haven't lapsed in vaccination for those viruses, which can cause severe outcomes as well. And so all of that needs to be in place. And then we will be starting our influenza vaccine campaign. And the very young and the very old are usually most impacted. So that would be really important for the younger kids who may be susceptible to influenza, having not seen influenza in the last season. They'll be more susceptible to the return of influenza. So I think those are some of the preparations that can be done. And then the overarching systemic changes could involve things like improved ventilation. And in our indoor spaces, that can keep away the other respiratory illnesses as well. And so there's lots that we've learned that we can apply to minimize the severe outcomes of the other viruses. We are tracking influenza virus activity across the world and across the Northern Hemisphere. Right now, we're not really seeing much. RSV is the virus that we're seeing, which is higher than the usual expected levels. And that needs to be managed and watched very carefully because it can be severe, as I said.
Thank you, doctors. C'est ce qui met fin à la conférence de presse pour aujourd'hui. That will be all for today's press briefing. Thank you very much.
That is Canada's top public health officials giving a briefing on the pandemic situation in this country. Canada's top doctor, as you saw there, Dr. Theresa Tam, says there are about 4,350 daily cases of COVID-19. More than 2,400 of those are in hospitals, 800 in ICUs. Average deaths daily, 38. Tam says this is mostly people who are unvaccinated. Dr. Tam was also asked about the upcoming requirement for federal public servants to be fully vaccinated. This is something that will be mandated. We heard Prime Minister Justin Trudeau talk about it just the other day when he had a press conference. She was asked, should there be a passport required as well. She says it's likely staff will have to submit proof of their vaccination, but if there will be a passport-like document needed to get into buildings, that still hasn't been decided. And some of the big news out of there, Dr. Supriya Sharma, Health Canada Chief Medical Advisor, was asked about the Merck pill. Now, this is a COVID-19 pill that has shown to reduce hospitalizations and deaths in half. The first one shown to treat COVID-19. Now, Sharma says a submission was made by Merck back on August 13th, and Health Canada is currently reviewing that. And of course, for those who have younger kids between the ages of 5 and 11 who are wondering when there will be some sort of vaccination allowed for them, Sharma was asked about this. Some news on this one, saying that Pfizer will submit advanced clinical trials to Canada next week for those aged 5 to 11. Then expect the official submission from Pfizer in mid-October. But she also says it will be a different dose or formulation for that age group than that of adults. So expect that to happen in the near future. You can see they're moving with that, but still not approved as of yet for the ages of 5 to 11.